Welcome to the Ventilatory Management Supraglottic Airway Device Skill Station. These progressive skills are designed to evaluate your ability to provide immediate and aggressive ventilatory assistance to an apneic adult patient who has no other associated injuries. This is a non-trauma situation, and cervical precautions are not necessary. You are required to demonstrate sequentially all procedures you would perform, from simple maneuvers and adjuncts to placement of a supraglottic airway device of your choosing. You will have 3 attempts to successfully place the supraglottic airway device. You must actually ventilate the mannequin for at least 30 seconds with each adjunct and procedure utilized. I will serve as your trained assistant and will be interacting with you throughout these skills. I will correctly carry out your orders upon your direction. Do you have any questions?
I do not.
Upon your arrival to the scene, you observe the patient as he goes into respiratory arrest and becomes unresponsive. A palpable carotid pulse is still present. Bystander ventilations have not been initiated. The scene is safe and no hemorrhage or other immediate problems are found.
BSIP, my scene is safe. I am gonna manually open the airway with a head tilt chin lift. And I am gonna select the proper oral adjunct, which I have an OPA here. I'm gonna measure it for placement. I'm gonna elevate the tongue, insert the oral adjunct. I have my OPA placed correctly.
No gag reflex is present when the patient accepts the adjunct.
Okay. I'm gonna connect my BVM and start manually ventilating my patient.
Ventilation is being performed without difficulty, but pulse oximetry indicates that the patient's blood oxygen saturation is 85%.
Okay, I'm going to place oxygen onto patient 15 liters per minute. Connect this onto my bag. And ventilate my patient 10 to 12 breaths per minute.
Breath sounds are present and equal bilaterally, and medical direction has ordered insertion of a supraglottic airway.
Okay. I'm going to instruct my partner to pre-oxygenate the patient. While she's pre-oxygenating the patient, I'm going to check my equipment, select the correct size oral or king airway. So I'm gonna inflate the bulbs 60 to 80. Check. Just make sure there's no leaks, no cracks. Everything's good. Okay. That connected. Got all the right equipment. Securing device. All right. I have I'm gonna lube the distal tip. Alright, get that, put lube on the distal tip. When I instruct you, I want you to remove the BVM and the OPA from the patient. So after your next breath, go ahead and remove the BVM and the OPA. Okay. Tilt the head, place that in there. Place it to the correct depth. Oops. Get the bag. Can you connect the bag onto the... Alright, can you secure that? Alright, I'm gonna use my stuff. Check for sounds over the epigastrum. And check for breath sounds in all 4 quadrants. Okay. I don't hear any sounds over the epigastrium. I hear breath sounds in all 4 quadrants. At this time, I would use a secondary confirmation, so I can use my in-tidal CO2. Can you, I'll secure the device. Can you remove the bag? I'll place in-tidal and place the bag back on. Continue giving ventilations. I would connect this to my monitor, and I should see a proper capnography waveform on the monitor.
How would you know if you are delivering appropriate volumes with each ventilation?
Equal bilateral chest rise and fall. And at this time, I'll secure my device. Device is secured and continuing ventilations at 10 to 12 breaths per minute.